Hi, I'm Ann Loring. I'm the manager of the education department and the nurse residency program. And what we want to do now is demonstrate for you the fall prevention measures that CHI St. Vincent uses based on their Morse fall score plus the ABCD assessment for their fall risk. There are 3 levels of fall risk. There is the standard or global prevention measures for all patients regardless of how sick, how unsteady, or how oriented. We apply those measures to every patient because they're good practice. There's the medium risk for fall, and those patients score higher on the fall risk scale above the global prevention measures and require us to add implementations to protect them from falling and to alert the hospital staff that they're at risk. And then there is the high risk for falls. Those patients require all the global measures, the medium interventions, and additional implementation to set off alarms and alert staff to immediately come to the needs of the patient. So we're going to start with discussing the low risk for fall patient, which is global interventions we apply to every patient who comes to the hospital. For these patients, I should be able to assess their level of consciousness. They should be awake, following commands. Hi, Kelly.
Hello, Ann. How are you?
I'm good. Do you remember me, your nurse from today?
I do. I'm so glad you're back.
Great. Can you tell me your name and your date of birth?
My name is Kelly Callahan. My date of birth is 123.
Can you show me where your call light sits next to you and how to use it?
My call light is on the right-hand side because I'm right-handed. I'm dominant on that side.
Great.
Yeah.
So she can clearly tell me how to use the call light, follows commands, and makes no effort to do anything unsafe. I'm going to now make sure that she gets all the standard measures. Kelly, before I leave the room, I'm going to make sure that I put everything close near you.
Okay.
Your phone.
Yes.
Obviously your call light.
Yes, right here.
Is there anything special you like at the bedside?
No, that's good. As long as I have my phone. I need my phone.
Okay.
I'm set.
Great. Let's make sure your bed is low to the ground and the
Okay.
brakes are set.
Okay.
And let's also make sure that you know if you do need to get up and use the restroom, that you call
Yes.
us so we can assist you with that.
Yes, I'll always call you.
Okay. Are you hurting anywhere?
No, no pain.
Not at all.
No.
So I'll make sure that I position Kelly, give her cushions so she doesn't feel the need to get out of bed without assistance and get her own pillows or extra blankets. And before I leave the room, I'll ask her, what else can I get for you before I leave?
I'm fine. Thank you for checking on me.
You're welcome. I'll be back in an hour, or
Okay.
my coworker will be back in an hour to check on you again and make sure that we address your needs.
Okay, that's awesome.
Great. So those are the interventions we apply to all patients. Next, we're going to talk to Miss Sandy. She's the next patient on my patient load for today. And so as I knock on the door and enter the room, and I greet Sandy. Hi, Sandy. How are you today? Do you remember me and your nurse?
Yes, I believe so. I think you came in my room a little bit earlier. I've just
Yes.
seen so many people.
I know it. You're right. I was here an hour ago, and I'm back again to check on you and make sure you're safe and comfortable and have everything that you need. So while I'm in the room, Sandy, let's get you to the bathroom. And as I go to assist Sandy to standing, she is about up to onto her feet, but I notice she sways a little bit. Gosh, you're a little unsteady on your feet.
Yeah, the world's kind of spinning a little bit. So.
Okay. Well, I'm going to sit Sandy back down, and instead we'll offer her a bedpan or another measure, and I won't try to walk her. She's going to need some physical therapy probably to strengthen her legs and keep her from getting unsteady when we walk with her. At this point, I can automatically say, Sandy's at risk for falling, and I can stop now and implement some additional measures. Sandy, I'm a little concerned that you might fall over if you don't get help walking to the bathroom next time.
Yeah, I have that same concern.
Okay, so what I'm going to do is I'm going to put some special socks on your feet. It's going to let everybody know that comes into your room that you need assistance. So I would put these non-skid yellow socks on Sandy's feet. I'm also going to put this yellow armband on you, and that way even if you're sleeping in bed and they can't see that you're wearing socks, they certainly can see that you have a yellow fall risk armband. on your arm. Okay? The next thing that I want to do, Sandy, is I'm going to put this sign outside your door, and so that even though they have not even yet entered their room, if they see through the doorway that you're walking by yourself to get something, that they can come in right away to help you. Okay? So we've now got 3 additional measures for Sandy that alerts the staff that she could use some help when she gets up to walk. What I want to say, Sandy, is in your room there's a sign here on the wall that says, "Call, don't fall, please." So at this point we don't want you to get up for any reason without some help. Okay?
That's what I'm going to do.
Excellent. So what I'm going to do now is make sure that Sandy has in place all the things that I offered to Kelly. I want the bed down low, the brakes are set, and let's make sure that your side rail is not up on both sides of the bed so that if you do need to get up, there's nothing to hang yourself up on.
That sounds good.
Do you know where your call light is and how to use that?
Hang on just a second.
Oh, yes, let's get it close to you. So I would put the call light closest to Sandy where she can use it and have her show me how to push that button.
Which button do you want me to push?
Right, the one that says call nurse, the red one right in the middle.
Are you sure? Everybody might come running in.
We hope they do.
Okay, there it goes.
Okay,
There's that red button.
so we'll make sure Sandy knows how to use her call light, and now I want to ask her, let's make sure you have everything close to the bedside. What do you like at your bedside table?
Well, I can't see very well without my glasses, so I always need those.
Okay,
And my teeth are handy when it's time to eat.
okay, I'll put your denture cup with your teeth right here next to your bedside.
And of course you have to have your phone.
The phone, yes. Phone is there as well. Anything to drink?
They told me I need to be drinking a lot of water right now, so it would be nice to have my cup and my water pitcher close to me as well.
Okay, we'll do that. So we've made sure Sandy's got all of her personal belongings. We've assisted her to use the toilet, but in a safe fashion, probably the bedpan or a bedside commode instead of trying to walk to the bathroom. Her bed is down low. Are you uncomfortable at all? Any pain?
No, I'm doing okay right now.
Okay, let's reposition you so you don't feel the need to get up and get another blanket or pillow for yourself.
Okay.
And now that you're comfortable, what else can I get for you before I step out the room? I'll be back in about an hour.
I actually think I'm okay right now. You seem to have taken care of all of my needs.
Excellent. Myself or my coworker will see you in an hour. Thank you so much for letting me take care of you.
Thank you. It was nice meeting you.
You're welcome. So now I'm going to go see my 3rd patient on my patient assignment for the day, and that's Miss Sarah. So as I walk in the room with Miss Sarah, what I notice is she's actually half out of the bed, and as she's standing, she's lunging for the side rail, about to topple over, and I'm lucky to catch her just in time.
I need to go to the bathroom.
Okay, Sarah, let me get some help, and I'll just push the nurse call light and ask for a second nurse to come help me get Sarah back in the bed because she's very unsteady and clearly cannot get up by herself. So at this point, Sarah is a little disoriented. She's clearly attempting to climb out of bed and she's not able to remember to use her call light. We know too that Sarah has had surgery about 4 hours ago, so this might be related to some of the medicines from surgery. In any case, she's just too unstable and too disoriented to do safe things. So we're going to implement some additional precautions. So Sarah's going to need to have a bed alarm, and her bed does not come with a bed alarm. So we're going to get one from our supply room. In the supply room, we have bed alarm pads, and we also have boxes for the bed alarm in every room called the Posey bed alarm device. And these are typically mounted hanging on the wall. They're battery operated and they're portable. They plug in just as if you were plugging in a telephone line from the bed pad to the box itself, connecting it into the side. You'll hear it click when it plugs in. The batteries are stored in the back of the box. You need 4 AA batteries, and you should put a fresh set in the box every time you put a bed alarm on a patient. Don't assume the batteries are good. The bed alarm has a single on-off button at the top back. It also has a silence the alarm or pause delay the alarm button on the very top. That gives you an opportunity to silence the alarm as you approach the patient and reposition them back on the pad, or to turn the patient without it going off erroneously while you're providing patient care. It has on the side settings. There's several options. Most of these are not required to be adjusted. However, there is one you should always confirm, and that's the volume. Make sure that the bed alarm is loud enough to be heard from wherever the patient is sitting all the way back to where you would be working if you're at the nurse's station. If that's not able to be done, the patient does need to be moved closer to the nurse's station so that the bed alarm is audible for wherever the patient's room is. There is a way to connect these bed alarms directly to the call light system. For these patients, they're not going to use the call light. So it is necessary to assist the person at the desk, the unit clerk or the charge nurse or any other staff there at the nurse's station by being able to hear and see the room call light system go off if Sarah were to try to get out of bed and trigger the bed alarm. That requires a separate cable. The cable connects to the side of the box and plugs directly into the wall where the patient's call light would plug in. So the call light unplugs, the bed alarm plugs in. So now that I've connected my bed alarm and I've turned it on to make sure that it functions and my batteries are good, I want to make sure that the pad is placed correctly under Sarah. If I was in the bed with this patient, if the patient was in the bed, not in the bed with the patient. What I wouldn't want to do is put the pad under the patient with the cord pointing towards the feet. This should happen the opposite direction with the cord pointing towards the head of the bed. Additionally, the bed pads come with metal clips that assist the provider with securing the pad to the mattress, the sheet overlay. However, be very cautious with leaving these clips on the pads. It's better to reposition the pad frequently than to accidentally have the patient work its way on top of this clip and be laying on this for an extended period of time. They're easily removable. You can just literally slip them right off. These are good for 30 days and they're single patient disposable. After you're done with it, it can go in the trash. So I'm going to position the bed alarm pad under the patient, under the heaviest pressure points. So that would be under the buttocks and also behind the shoulder blades. And we'll just have you stand for just a minute, Sarah, just to set it in the seat where we can kind of see that. There you go. So Sarah's sitting on the bed alarm pad at this time. If at any time Sarah were to try to get up, the bed alarm would go off. I can press the silence button while I assist Sarah back to bed to get back on the pad. Very good. Now, in addition to that, the bed alarm, I want to make sure that Sarah has all the interventions that I applied for Sandy. So she needs to have yellow socks. She needs to have the yellow band. She also needs to have the fall prevention sign on her door to alert any visitors or any staff that there is a person in this room that's at risk for falls. And then I'm going to go a few more steps with Sarah to protect her. We're going to place a fall mat on the floor next to the side of the bed that Sarah has a tendency to want to climb out of. If she climbs out on either side, I might actually need 2 pads on either side of the bed on the floor. In this way, if she were to find her way climbing out of the bed and actually fall, our goal is to prevent injury associated to that fall by cushioning the blow to the floor. So I'm going to turn the pad so that the tags are facing towards the floor and the flat side of the mat are up against the edge of the bed. and the bevel side is out so that no coworkers will trip on the mat. I'm going to make sure that Sarah has open access on this side by making sure at least one of the two side rails are down on the side where the mat is lying. We don't want her hanging up her legs or getting stuck and hurting herself trying to climb out of bed. The next thing I'm going to do is ask for the family if they're capable to sit with Sarah for the afternoon and keep an eye on her. And luckily enough, her aunt just happens to be here, and she would love to sit with Sarah and remind Sarah not to get up or call us if Sarah feels like she's trying to climb out of bed. Finally, I'm going to get what's called the fall prevention measure letter, and I'm going to explain it to Sarah's aunt, Kelly, all of the things that we've put in place to prevent Sarah from falling and get her signature on that letter. I'll make a copy and give it to Kelly and put the other copy in the chart. That basically makes sure that we've explained how scary it is for Sarah to be left alone and all the things we're doing to keep her from hurting herself. Additionally, there will be a sign on the wall. It says, "Please call, don't let her fall." Please don't try to assist her yourself. We'll be happy to come help you. I'm then going to go to my charge nurse and let my charge nurse know, Sarah could really use a room closer to the nurse's station so that all the staff can keep an eye on her. So as soon as a bed is available, we would love to move Sarah to that room. And then the charge nurse at the shift change will let everybody on the unit know we all need to keep an eye out for Sarah. She's very at high risk. I'll document all of these interventions in the medical record that I've applied for each level of fall prevention. Before I leave the room, there are some global precautions that Sarah should have in place. What are they? Bed is down low. The brakes are on. I'm going to put everything close to Sarah that she needs. What other things does Sarah like to have handy that keep her distracted?
She needs her cell phone.
Her cell phone.
She's confused.
Okay.
She needs her cell phone.
All right.
She plays a lot of games.
Okay, I can see if we can get a deck of cards, or if you happen to have a particular game from home that she likes, please bring it in.
Okay.
So we'll put those things close by. We're going to give that call light, if we have not connected it to our Posy Bed alarm, to the family member, and make sure that they know how to call me whenever Sarah needs some help. I'm going to make sure that Sarah's not having any pain. I can ask her, but I'm also going to assess obvious signs and symptoms for pain. If she has I call them a frown face or a crinkly eyebrow, or she feels very restless, I can identify symptoms of pain that maybe I can treat to keep Sarah more comfortable. The other thing that I want to do before I leave is make sure that I tell the family member I'll be back in an hour. Is there anything that I can get for you?
No, thank you. You've been very helpful.
Okay. I'm going to make sure that we reposition Sarah so she's as comfortable as can be, and document on our rounding sheet the high-risk measures for fall prevention, and I'll be back in an hour. Thank you so much for letting me take care of you.
You're welcome.
And those are the 3 levels of fall prevention at CHI St. Vincent.